We are group 22. My name is Zainab. We are doing the Osteogen bone grafting plug. So to start, how and when to use the Osteogen plug. So normally after an extraction, bone graft would be placed in a tooth socket for socket preservation, and a collagen plug would be placed over top of it to provide protection. So the Osteogen plug provides bone grafting and collagen plug in one. And it is used following dental extractions to promote bone healing and regrowth. So some of the properties and features, it is made from a bioactive resorbable calcium apatite and a type 1 bovine Achilles tendon collagen matrix. So the calcium apatite is similar to human bone, and the collagen matrix carries the bone graft and it eliminates the hassle of particulate graft. This also removes any chances of particulate bone from getting washed out. It acts as a wound dressing, promoting proper blood flow to the site, which is essential for the beginning stages of angiogenesis and bone formation.
The product we are comparing our Osteogen plugs to is the glycolate BioOs collagen. This collagen consists of 90% glycolate BioOs granules and 10% highly purified porcine collagen. The collagen material is derived from a different animal, so it's a xenograft. This differs from the Osteogen plugs, which are autografts, and collagens derived from the Achilles tendon of the individual who the plug is going into. Cost-wise, the Osteogen plug is sold in different sizes, small, large, and extra large, and for 5 plugs or 10 plugs. I've just showed the data for the 5 plugs, and then the BioOs are sold small, medium, large, extra large for different measures in milligrams. It's kind of hard to compare them because the BioOs is packed into the tooth gap and the Osteogen is a plug. But compared to other bone graft materials, Osteogen plugs are known to be cheaper. One study has shown that the Osteogen plugs have better biocompatibility and elicit higher osteonectin release directly compared to BioOs collagen. And another study shows that the Osteogen plug is 3 to 6 times greater, has 3 to 6 times greater osteoblast proliferation throughout the Osteogen plug, with a higher porosity and better biocompatibility compared to xenografts and allograft options. The BioOs is a xenograft plug, so that graph shows that. And ease of use-wise, Osteogen plugs are marketed as being easy to use because of they're already put into a collagen shell or the collagen plug. And the Osteogen graft crystals being put into the collagen plug allow for a 2-in-1 plug bone graft instead of being a material that needs to be packed and molded into the tooth gap.
So the significance from a dentist standpoint, the Osteogen bone grafting plug is easy and can be efficiently delivered into the socket. Its ease of use comes with its availability to be manipulated, so it's not a one-size-fits-all model. For example, the Osteogen plug comes in different sizes, such as large, as well as a slim size. Multiple plugs can also be used at once, and strips can be used to fill the gaps around implants. Another important component of the plug is that it appears radiolucent when placed in the socket. Dentists can then efficiently monitor the healing of the bone. This can be seen in the picture at right, where the top picture appears radiolucent and contains the Osteogen plug, and the bottom image is radiopaque, indicating appropriate bony healing. The ability to confirm the bony healing therefore allows dentists to successfully place implants that will have predictable results. When a patient has a tooth extracted, the Osteogen plug or bone graft may be used to rebuild the density of the bone. In comparing these two mechanisms from a patient standpoint, The Osteogen plug requires one step, placing the plug in the extraction site and preserving the bone during healing. By doing so, this will prevent the patient from having to come back for an additional bone grafting procedure. The single step associated with the Osteogen plug therefore makes it a more affordable option for the patient. The one-step Osteogen plug also eliminates the time the patient is sitting in the chair, as it is a quicker procedure and requires less mixing and packing to put the particulate together. Additionally, the Osteogen plug can get incorporated into the bone while the bone graft does not become osteoid. This therefore can increase the chance of failure, which causes additional problems down the line. Lastly, the Osteogen plug containing growth factors, which enhances the healing process, while the bone graft may disappear or lose volume from the lack of nutrients. Overall, the Osteogen plug is more affordable, requires less steps, is a shorter appointment time, and increases the healing ability of the patient's jawbone.
As mentioned previously, the Osteogen plug is combined product of osteogenic bone graft with type 1 tendon collagen. Because the graft is contained with the collagen, no separate collagen membrane is required to cover up the site after the extraction and the bone graft. Provider could just drop the Osteogen plug into the socket right after the extraction and quick cross suture over the top to retain it into the socket. Osteogen plug is very hydrophilic as liquid is absorbed straight up into and throughout the plug with the collagen structures. Once placed into a socket, it will absorb blood flow and expand to fill the defect, increasing in size and eliminating any potential gaps. So when the provider is opening the individually sealed booster tray, it is very important that Osteogen plug is delivered dry into a socket. It is only when the osteogen is dry, it is firmed, yet remains malleable and can be shaped prior to placement. Once it is absorbed to blood or liquid, it has shaped memory, thus it will predictably retain their shape. Different sizes can be cut down or shaped to fit a specific defect and tailored to its unique clinical situation. Also, Osteogen plug is proven safe, reliable, and clinically effective for use as a synthetic bone graft material for nearly 30 years.
And finally, to conclude, our group recommends this product for three main reasons. First, biocompatibility, because each plug contains resorbable calcium apatite combined with collagen that promote healing, and the combination of this will provide hydrophilic structure that mimics the composition of human bone, and this is what makes it biocompatible. The second reason is because the use of this product is quite easy. This is because it is a one-step process that the dentist did not need to mix or to use any other applicator tools. And the result of this, the procedure time will be reduced. And finally, this material is affordable, and that is why we recommend this product, because it combines both affordability and innovative healing.